we have a team together. There are some other forces which are which will try to bring down the satellite as well. Sometimes the atmosphere is not good, the wind will be different. We have to calculate so many things. In our department also we had challenges. We had to have our own to start with our rehab ENT department, speech therapists, and psychologists, which we need if we are getting help from like a psychiatric department. We do have smoker CMC. These yellow things are the ones which we have right now in our department, whereas the green ones we take support from other departments. Yes, when we talk about the team, this is the team we have. We have got nurses. We've got therapists on the right side, and we've got occupational therapists and occupational therapy assistants. We've got prosthetic and orthotists, and we have prosthetic orthotics assistant also. This is the team. As we say, whenever we have to achieve certain things, we need to have a team which is very professional and they have disciplines to meet regularly. This is our actually, I should say, the mantra or magic, I would say, because we actually meet regularly, and each person of our team has actually allocated a significant proportion of time to be spent with the patient. We have a goal setting, and we make sure that each person gets adequate time to spend with our patients. Before that, we agree on the objectives to be achieved. Each one has their own defined geographic base. There's a clear differentiation and respect for skills of each person, each team member in our department. What are the objectives? Yes, we prevent and manage intercurrent medical complications. We might minimize the disability, achieve maximum functional independence. We facilitate psychosocial coping adaptations. We also help in reintegration into home.
Dr. Santosh, it is on. Please go ahead.
Yeah.
You have stopped your screen sharing.
Aims of our rehabilitation is to, it depends on the predicted prognosis. We should make sure to take into account the available resources.
Dr. Santosh, share your screen, please.
Ma'am? Ma'am?
Yes. Dr. Santosh, share screen button, green color button.
Sorry to. Yeah.
Dr. Santosh, you are connected, well connected. You have stopped your video. Please switch on your video, share screen. Audio is okay already. Please continue.
Post disabled. Yes, can you see me, sir? Can you hear?
Yes, yes. Please share your screen.
I'm sharing. Yes, screen share. Correct. Okay. Anish. Can you hear me now, sir?
Yes.
Yeah. Sorry. Um, some internet issues. Sorry for that. The objectives of rehabilitation are to, as I said, we help the patients reintegrate into home, family, community. We also help them re-establish a meaningful and gratifying life in their patients. Our aim depends on the predicted prognosis, and we should take into account the available resources that we have. And we have something as goal setting, and we have seen that goal setting actually increases in the long-term benefits of our rehabilitation patients. These goal settings can be short-term and as well as long-term. These goals that we set are should be meaningful, challenging, and they should be also achievable. Patient and family involvement in goal setting increases its effectiveness. As you can see, as soon as I joined CMC, as I told you, initially we didn't have any team, but neurosurgeons requested me and see this video photograph that whether I can do something about this guy had a road traffic accident and broken his neck and cervical vertebra were broken. And neurosurgeons has asked me if I can fix him. So I said I can do an external fixation of his broken cervical vertebra. So I didn't have a team; I was alone. So I requested physiotherapy students to accompany me to the operating theater to help me. So I took them, and with these students supporting me, we could do a halo vest fixation for this boy, Supinder's thing. Yeah, I think it was the first one which was done in CMC, as far as I understand. And after a few years, when he came, I couldn't even recognize him. This is the same boy who I operated and fixed his head and chest. But thank God his cervical vertebra healed and he's absolutely fine walking. He didn't have a neurological difficulty. Then this boy also came who had a infection of his brain, and that caused a cardiac arrest also because of the infection. He was actually wheelchair bound, unable to even stand. He had urinary incontinence, and because of which he's on invalid catheter. He had requested me for his breathing challenges. When he came to us rehabilitation, we took him in, started training for him. Then finally, after a few years, he comes and comes to my OPD and stands there, and I couldn't even recognize him. This is the same patient whom we treated, and he is absolutely fine with nice goggles around. So rehab actually with a structured program, I believe that many things can be achieved. It is all achieved through teamwork. That's what I believe, that teamwork is a dream work. That together with our team members, we can achieve many, many more things. Whenever a patient comes to us, we usually have a patient in front of us sitting, and then we make a plan with the patient's thoughts and what he exactly wants, and all our team members contribute to his problem solution. Even during our COVID, we took a lot of precautions while seeing patients, as you can see. Then came this Shiksha Abhiyan. When I joined, then the government of Punjab was looking for some rehab person who can operate on children going to the school. Why these children are not going to the school? Because they were disabled or differently challenged. So government was looking for rehab to operate on these children and make them go to school, back to school again. This is education ministry which was involved, and patients started coming through. Teachers would bring the patients. Patients would come like this, and we received them reception, warm welcome for them. Our junior doctors go and receive them and make sure they have adequate wheelchairs and trolleys to bring the patients in. They do assess the patients, our junior doctors from other disciplines. Then I would assess them as well after interns would have seen the patient. I would also assess the patients. And main important thing is, after assessing the children, I would counsel the parents that their long-term goals and how important it is to do the commitment of these parents to rehabilitate kids. So we are doing some examination locally. Then I saw that these children, majority of the children needed occupational therapy. So we started off occupational therapy services. We got two vibrant occupational therapists from CMC, and through their services, we could start occupational therapy services with which autism children or whether any type of disability, they were given adequate training. As you can see, some of these photographs showing that. And some of the children, before COVID times, we do these kind of artwork through occupational therapy, involve the parents and the children. Some of these children needed serial casting. So we would do serial casting, which is very cost effective to rectify the deformities of the limbs. With our team, we take the help and then we do casting for these children to rectify the deformities. Some of the children will only casting under anesthesia. So we'll take them out to the theater and cast the patients there. This is one of the hemophilia child who needed casting for his knee flexion deformity, and we would leave a medial side window for the stimulation of the vastus medialis. Some of the children needed surgical correction, yes. So we started operating on these children last week, Ria, our medical intern, was involved in doing the surgery for the children. We encourage our interns to learn to do surgery because Bachelor of Surgery is also there. They should know how to cut to make an incision and suture the patient. Rahil is a present intern with us. She is also learning how to do suture. Dr. Praneeth Dhaliwal was actually right now an assistant professor in pediatric department today, and she was an intern with us. I hope the surgical skills that she learned, they are useful in pediatric patients to teach with. Some of them would come with deformities, very severe deformities. We would operate, and next day itself, the legs, feet would be absolutely normal, and they can actually ambulate that. This is post-op rounds in the wards, and after post-op rounds in the wards, we take them. Next day, these children are discharged in the main hospital and are sent to the peripheral center in Hamra for rehabilitation. We rehabilitate for at least 4 to 6 weeks. Inpatient vigorous training is given at rehab in Hamra. This is the Hamra hospital. And when we started off these services, our health minister came to see, and we were privileged to have our Omkar Singh Pawaji, and the health minister wanted to see actually these children getting benefited. And these are some images when she was there. These are present images where our admitted patients right now, today they are getting the rehabilitation in Amra. We have physiotherapists and physiotherapy assistants helping these children.
Dad, I see a key with you.
Some of the patients actually, and other patients who are adult patients who can have similar problems, when they encourage other children, they feel that they also understand their problem. So some of the children learning how to do push-ups. These are some of young children who are rehabilitated. This is a ward inside the Amra Center. And some of which these children are given task of completing 50 meters in particular time so that they can earn some gifts. They come back after 2 months for the follow-up in our OPDs in the main hospital once they are discharged from Amra Center, and see them that they are doing absolutely fine by God's grace. We also observed that some of our children needed braces because without the braces, they may not be able to keep the deformed limbs straight. So we thought of having a brace shop for ourselves. We called it Artificial Limb Center. I came to know that we used to have an Artificial Limb Center many years back, but it was shut down for some explicit reasons. But with the help of CBM, we could actually start this brace shop center there, and we have a small unit here even in CMC. Our prosthetic and orthopedic specialists actually make AFOs, belts, cervical belts, lumbar belts, TK braces, hand splints, below knee prostheses, above knee prostheses, etc. This is one of the patients who benefited from above knee prostheses, as you can see. Then we not only seeing the patients in our OPD, we actually go into the community. This is pre-COVID times when we would go to the different parts of Punjab, remote areas almost near the Pakistan border. We would see and do the scans and screen the patients. Once the screening is done, they are encouraged to be brought to CMC for surgical correction in April. So we have a coverage of Sangru district, Patiala, Mansa, every district in Punjab we were covering before COVID times. These are some of the images of our screening camps. Then we thought we need to bring awareness about differently abled patients, that they are also part of a society and they should be given full participation and equal opportunity. So we started encouraging to celebrate as a Day of Disability, International Day of Disability on 3rd December, through which different programs would be organized so that patients can, our society can be aware of what are the challenges of differently able people. So we would have interaction between all these patients among each other, how they are doing, yearly do a checkup for them on December 3rd. And we would tell them that the kidneys are doing well, and if they need some modification in their splints, we would do repair of the splints. We would give them special medications if required and make sure that their kidneys and other organs are well. These are some more images of different years that we have done. I would take you to some small interesting stories that we had recently and the past. This is Kalpana Giri. She's a girl who's 22 years, she was crawling on her hands. She would use special chappal for so that her hands doesn't get dirty. As you can see, she came in 2013 to our OPD, crawling into our OPD. And with the support of some donors, we gave her a wheelchair at least. We said, at least don't need to crawl on the floor, you can use a wheelchair. Then after some time, we admitted her for, you can see July and August, 2 months she was with us. Almost 8 weeks of intensive rehabilitation, where we corrected her deformities in her lower legs. And she could stand and walk and be independent. And the next year she would come and say, I can't climb stairs with a walker. So we trained her with the quadripod in both her hands. So we did not remove the disease per se. She still continues to have poliomyelitis. She had the recovery and she had the post-sequelae of poliomyelitis, and she continues to have weakness in her lower limb. But what we did was, at least if she can't, if she can at least walk on her own. I'm sure many doctors she would have seen for 22 years. But with the rehab team coming into her life, with the team where we have, as a team, we make decisions and objectives and try to achieve in a specified time. That is 4 to 6 weeks. Then we saw that was able to independently walk, stair climbs, and last week, couple of weeks back, came to my OPD with a wonderful family. She's got married and she's got 2 children. Dr. Tapasya ma'am was graceful enough to support delivery, and both the deliveries were done in CMC. She's having a wonderful family right now. So she got discharged after second baby's delivery last 2 weeks back. This is another patient, Inderpal Singh. He's a stroke patient, and he was transferred under neurosurgery, and neurosurgery discharged him and requested if we can do something for rehabilitation. We said yes, he's on NG-tube feeds, he's not eating, he's on indwelling catheter, he's completely bedbound. So when we went and met him, at least right side of his upper limb and lower limb were working, left side was not working, and so we said there is a possibility because he was communicating well. So we kept him under rehab, and for next 3 weeks he recovered very well. And these are some of the images of exercises that he was receiving. Yes. And then last week, after 4 weeks, he got discharged. Very surprisingly, when he was with us, even the consultants and residents, they thought what he is doing in the PMR department, he should have gone home. Anyway, we have removed the clot that was there, and he's fine to go home. Why is he here in CMC? But I think with the rehab playing a role in his life, as you can see, this is yesterday's photograph when he is standing at home, eating on his own, walking into the washroom on his own at home now. So rehab makes at least possible for a person to be independent in activities of daily living, like eating on his own, walking into the washroom. These are some of the possibilities after stroke. Govinda Singh also came. He was also a paraplegic spinal cord injury patient. We taught him how to walk on a ramp and very beautiful surfaces. But when we went to his home, see him at his home, a junior doctor went to the evaluation, and we saw that these services could not be utilized at home because home conditions were different. He had a muddy entrance, and there were bricks, as you can see in the photograph. He could not come out of his house. I said, Madam, how can I come out because my home house is not disabled friendly? So with the donations from Dr. Jason, we could make a ramp for him for outside his house, and he could be independently coming out. Then he asked for a vocational rehabilitation. We asked him, we talked with him. He said that, can you provide me second-hand auto rickshaw so that I can drive for my living? So this auto rickshaw is modified, still doesn't have power in his lower limbs. He has upper limb strength is there. So this auto was modified, and he could drive his auto from railway station to Samrala Chowk. Later on, he got married to the wife, and then seeing all this outcome, where our junior doctor was there, Dr. Shipra Singh, she was so impressed as a junior doctor that so much can be achieved that she decided to do her MD in PMR department from CMC Vellore. She's a consultant now in Kerala. Surjit story is this kind of similar one. This patient had a bed sore when he came, and I took this photograph and I rehabilitated Ram Singh, who's on the right side. And I told Ram Singh, you should go and encourage Surjit that you can also walk someday. Dr. Bobby John sir had referred this patient, Surjit, and he had multiple bed sores and infections everywhere because of the knee was falling on another knee, There was a medial sore that made a osteomyelitis of the knee, and sir had to open and clean the whole knee joint, remove the pus and suture, and he sent for rehab. And sir also told me that before I could commit something, he said that this patient had osteomyelitis of both the hip joints, and uh, and we had to remove the femoral head so that he should be saved of the infection. And those both after surgically removing it, his wound healed and he was better. But I told, then we said, okay, rehabilitation can be done. He can be ambulant. So I said that make sure he's ambulant and rehabilitation happens. So nobody was willing to hold him. He was bedridden for 3 years and he was thinking of urine and stool and all that. So, but I knew what I learned from CMC-La that these patients can be ambulant and they can be pressure sore free. So I held him up and with the help of physical we could make him ambulant. And he learned therapy, and as you can see, Dr. Kim Maman is congratulating him. We went to his house and we saw that his house was not disabled friendly. So we had to make the door wide open. We had to make a rope for slope for him to come out of the house. Then we asked him for what are the best things that he can have for rehabilitation. So he said, can you give me a shop, a petty shop that can be opened for his living? So we helped him to open this is the inauguration of his shop. Again, I would say teamwork is the dream work, where without the team, these things cannot be achieved, and does not happen in a day or two. We have a 6 to 8 weeks very vigilant and strict therapy protocols that are followed, and so we do something called as peer counseling sessions also. We organize meet for these patients to come together as Surjit independent and other patients became independent. Other patient relatives would come and actually have interaction among each other. Relatives would talk to relatives, and patients would tell them that I was like this and I became independent through rehabilitation. So as you can see, Mr. Ashok is here. He is actually bedbound for the last 5 years, and he was very curious. He was not sure whether he can also be ambulant. He said, I've been bedbound on a wheelchair for the last 5 years with the invalid catheter. So we rehabilitated this patient. He's actually a paraplegic. He's actually wearing a calipers under his hands, and balance was so good that we cannot make out that he's actually paraplegic. It's again zero power, to be noted that he's got zero power in his lower limbs and still wearing calipers and balance. He learned good balance with the help of our team. This is an outpatient therapy that he did very well in his life. So Ashok also had doubts, but we admitted him in Hamada for rehabilitation, and for 4 weeks to 6 weeks, he became so independent. He started walking with the support of crutches, and now he could drive his Activa and take his wife for shopping and also children to the tuitions. We do something called as community-based rehabilitation, provide an alternative to inpatient services. If patients can't afford to come, we provide the service at the doorstep. It is an education-based and need-based training we give for the disabled patients. They are obviously linked to our secondary and tertiary reference services. We follow up through peer interaction, patient to patient. They call each other. They have communication. They will tell what kind of catheter size you use, what are the medications. They will tell each other that yes, this is how I'm doing it. You can also do. So, and once in a month, these patients have meetings among each other and discuss the possibilities and probabilities. We came to know that this during this community-based rehabilitation, that there's a patient at home, Veena, who's disabled and she's been bedbound for the last 5 years. So we went to meet her and visit her as a team, and then we saw that she's got a good potential. At least we thought if she can become independent, then she can be helping the husband in cooking and other things. So we brought her to Amra Center, rehabilitated her, and she became independent in walking, and she could go to the kitchen and make chapatis and sabzi for her family. We have awareness classes even for our students. We take education classes for medical students, physiotherapy students, nursing, BSc nursing, and MSc nursing students as well. We have classes in our department as well. Of images when we are educating them. The nurses have been trained. We have some of our patients who are disabled. We have a tie-up with a lovely professional university where our disabled patients, if they want to pursue their higher education, they can get free education from LPU Jalandhar. We have a tie-up with them. So nearly 16 students, quadriplegic and paraplegic, are enrolled there, and these patients are perceiving. Some of them are doing quadriplegics are doing journalism, etc. With modified skills. They are given free education there. They stay there in LPU. They are the special hostel for differently challenged patients. Not only our patients, we thought we should train our personnel in our department. We could send our Sunita ji, our rehab, our nurse to CMC Vellore. She did a diploma course in rehabilitation nursing, and she got trained and exposed to what type of challenges we have. And she came back and she's doing well in our department. Same with Sanjay Bhaiya. We had our own race shop, but we needed somebody to go and learn the techniques how to make prosthesis and orthosis. Sanjay Bhaiya went. It was difficult for him also to go to South India, even for our staff nurse Sunitaji, to go to South India and adjust to the code and language. But yet, God has been good to them, and they both completed their courses and came back. And right now, they are serving our institution. For the future of our department, we see a great future and bright one, and so much to be done in less time. Yes, we expect that in the future we'll have a treadmill training, body weighted support, and these are the things that we can start off, which we hardly. And Locomat is a robotic training where ambulation for even zero power, and from day one we can actually put them into this robotic training and help them ambulation and robotic help can be achieved. This is there in Gokilagan Hospital and also in Lucknow. There are only two centers in India who have this Locomat. RMO is an upper limb training where biofeedback and robotics can be used to train the upper limb which are. This is the proposed Department of PMR future building that is expected to come up. Already work has started, and this is the blue map of the place which we will have the construction going on. And I'm thankful to many people, including Dr. Mary Varghese, who was there. She's the one pioneered. She's a medical student who had paraplegia. As you can see, she went to Vellore, America, to train herself as a rehab specialist, and came back and started rehab department. Through her, even though she was a lady, she faced very lot of challenges, as the challenges I see sometimes in CMC as well. But she was on a wheelchair, and she would go to the director and ask for some help, and she would immediately get it. We have different kinds of challenges even in our institution to get things done, but we want to thank this legacy has been carried on by Dr. Singh, and we want to thank Dr. William Bhatti, our director, who all the time supported me every step that you can do it, and yes, I'm thankful to him. This is a message from other patients who have benefited.
Santosh, we can't hear it. Audio, can you increase volume?
Volume, right? Right. This is one of the patients who benefited from rehab. I can show you this. Yes, sir.
Hi, I'm Laurie Taylor. Last year, in India, I had been quarantined having COVID, and Dinesh had massive brain hemorrhage. I got a call from Max Hospital where he was at saying that he was ready to be discharged. But I was there in quarantine, and when I asked, well, where should I take it? They said, well, you can take it. I asked them if there was a rehab around because Dinesh had not really woken up yet. He wasn't swallowing, eating, drinking. He wasn't going to the bathroom on his own. He wasn't talking, and he had moved any part of his left side. I asked around, and then his medical school friends said, well, you have to take it to CMC. That's freaked out. So Dr. Kutangi was ready to take us in, and Dinesh was able to go there, and I was able to see videos of him recovering while I was still quarantined, and I watched the love and the care of the team there, and the hope and faith. And for the first time since my husband's stroke, after a month, I saw. I got to watch my husband go from that, from his coma, to walking, and walking, coming back to Lily. Yeah, grateful for Dr. Kutangi and Robinson and the occupational therapist.
नेट खत्म हो गया.
Thank you, Santosh, for that excellent presentation. Dr. Santosh, can you hear us?
Yes, sir, I can hear you.
Yeah, thank you for that excellent presentation. I wanted to ask you, see, for generating awareness among the people regarding physical medicine and rehabilitation, in the villages and all we see, they are just, lying there. So you were telling some work is going on with the Punjab government. Can you tell us more about that?
Sir, we have ASHA workers. We have started training the ASHA workers in different parts of Punjab. We would go and tell them what are possibilities of rehab, and with the education of our ASHA workers, and also our Ministry of Education, where our school teachers, they're all brought, and we meet regularly and educate the school teachers also that what are the possibilities of rehab. So with that we achieve our goals. We try to educate them.
Okay.
Different areas.
I can see Dr. Bobina Chandy, our graduate. Bobina, can you hear us? Hello.
Yes, I can.
Bobina, hi, Bobina. How are you? I'm seeing you for some
good. I'm good.
20 years,
Thank you.
20 years or 22 years. I'm seeing you.
Yeah, we're going to be 25-year batch soon.
Yeah. Okay. Are you at Vellore or UK?
I'm at Vellore back here.
Okay, right. Welcome to the Grand Rounds.
Thank you. It was really lovely listening to Santosh's journey. And really praise God for the good work that he's done and he's continuing to do.
Yeah. It's open for questions, comments from anybody. You can unmute yourself and, please go ahead.
Yeah, thank you, Ashish. Dr. Santosh, thanks for excellent presentation. Dr. Santosh didn't mention how much pediatric surgeons are dependent on him. Reason being, we do operate on lot of children with neural tube defects. And once surgery has been done, following that, they are not able to walk properly, and there is shortening of one of the lower limb. All those issues are there. And for that very reason, we do refer our patients to PMR department, Dr. Santosh. And right from the beginning, rehabilitation process is started for these children. And it's a common, association with rehab in our hospital. And not only that, we are sharing funds also for poor children to provide them treatment. Dr. Santosh, it was good. You are taking care of patients, not only in hospital and with the follow-up at home and making sure they are fully rehabilitated. And I have witnessed your lot of rehab melas where a lot of people come and share their testimony, how they were benefited from your treatment. And that is our vision and mission also, which you are fulfilling by providing treatment to the poor and needy. We have seen in Hambra, a lot of surgical work has been done by rehab department. Not only that, rehab department is capable of taking care of urinary incontinence and other problems associated with the spinal cord injuries and all in adults as well. And I'm sure in coming years, we'll move forward and will touch many more lives. Thank you, Santosh.
Thank you very much, sir.
See, Santosh, many people have written in the chat box about the good work, and they are really impressed by the work that you have done till now, and they enjoyed your presentation as well. And an excellent example of teamwork, they say. They're all,
Yes, sir.
positive comments are there in the chat box.
Yes.
Dr.
It is because of the team.
Yeah, Dr. Jairaj, your comments, and then I think we can wind up.
खत्म हो गया.
Hello, I think Dr. Jairaj is left. Yeah. Anybody, any comments? Santosh, hello.
Yes, sir. Yes, sir.
You said you sent doctors to their home also for follow-up, right?
Yes, sir. Yes, sir.
Yeah. What is that? Can you tell us something more about that? How do you organize that?
So when we have whenever the patient who's challenged to, if we have to go, we go as a team, sir, not one doctor per se. We go as a team and go there and assess the patient at doorstep and see what are the possibilities, if they need any calipers, or are there any calipers to be repaired, or whether any changes in the medications to be made for these patients. So we go as a team, sir. Both occupational therapists, physiotherapists, and P&O, and myself and rehab nurse go there and see whether are there any incontinence issues. We checked also whether they're able to check whether the techniques are right. If it is a CIC that has been done, our nurses check the CIC techniques have been done properly or not, and calipers, are they properly fitting, or there any need to be repaired. And our physiotherapists assess their balance of these patients and weight training and all. And occupationalists will see whether they can perform their activities of daily living with ease, or do they need any new adaptations or new challenges. So as a team, we go many a times. By God's grace, recently we could help SP Oswalser's wife also. They would call us and we go and give the treatment at the doorstep occasionally.
Okay, that's very good. Yeah. Thank you, Dr. Santosh, for making this grand round presentation. In spite of all your busyness, you took time and did it. Thank you very much, and best wishes. And next week, we will have Dr. Mary John from the Department of Medicine sharing with us the story of COVID, how they were handling the second wave, and all the issues associated with that, getting amphotericin, mucor, and ventilator. So many issues were there around that mucor management. So it would be a very exciting grand rounds. We look forward to having you again next week. Thank you and have a great weekend. Thank you. Thank you, everybody.
बंद कर दो बंद ऑडियो भी बंद ऑडियो म्यूट करो